I'm Christina Edelbach, and I've been a nurse for 20 years, and before Lyme's I got to take care of people with health issues. So I'm used to being on the other side of things, and I love to travel, very active and enjoyed life, and then some random symptoms showed up that I suddenly was unable to do the things I love to do. As a nurse, I went through everything I could possibly think of, and Lyme's was not on that list. I had never been bitten that I knew of. 2019, March, I started to have on and off, I thought they were flu-like symptoms, so I would suddenly become really lethargic, not be able to get out of bed, had difficulty walking. The summer of 2019, I actually was unable to walk, even from my room to the bathroom on my own. I felt like I was on a teeter-totter constantly, so I couldn't gauge my balance. I did seek medical treatment. They tested me for everything from MS to ALS to all kinds of different things. And I even looked into functional medicine, and they did actually test me for Lyme's, but it was not acute Lyme's. So conventional medicine didn't want to treat me because it wasn't acute Lyme's. We didn't know for sure what it was, and we're like, maybe it just went away. So then March 2020, suddenly at work, I know the exact time, the moment it happened, I got flushed, nauseated, and dizzy, and that hadn't stopped until I showed up until Envita about 10 months later. And so those were things that really brought us to, we gotta figure out what this is, and if it is Lyme's, we gotta figure out where's the best place to go to deal with this. My husband actually found you guys online, and we knew about you, but it's a big decision. We live in Minnesota, so it's a big decision to come here and live here for months at a time. We flew down here for my consultation on November 8th with the thought maybe I'd go home for 3 weeks waiting for my lab results, but I wasn't even well enough to go home. But Dr. Warren was just very welcoming and he knew that I had a background in medical things, and so we just clicked in that way, and he was able to explain it to my husband and I very clearly, and it just was comforting to know that someone understood medically and what you'd been through symptom-wise and everything, and had a plan that was gonna get you somewhere. My husband had to go back home, but Dania helped us, and we found a place to stay, and helped us get settled in the sense of what we needed to do medically. And she gives you her phone number immediately and says, text me anytime, which of course I said, are you sure? Like, between what hours and what hours? And she said, no, anytime. And she means it, which is, first of all, that's amazing. Choosing nurses for your patients you have to really search for that. I've been a preceptor for nurses, and that's something that is hard to find sometimes, even if they really, really care. So these nurses truly care, and they really do everything in their power to help you through whatever you're going through every single day, even the littlest things. I found the daily support from the nurses and the staff, my PCC Dania, Dr. Warren, to help me through the process on a daily basis. If I had symptoms that I wasn't handling well, they adjusted my regime or whatever medications I needed. That's what I really needed to get through the process. My husband, he saw the progression before I did. He saw me deteriorate faster than I recognized, and then he's seen me come out of it faster than I've recognized. You gotta give it time. Not everybody does it at the same rate. This last weekend, I got to take my first hike up towards McDowell Mountain. I didn't get far, but I still was able to do a hike, which I haven't been able to do in almost 2.5, 3 years. So handing it over and giving into the process and to get your life back. That was my goal, to get my healthy, vibrant life back, and it's possible. It really is.